I was bombarded with a lot of distress calls. I've never had so many people reach out to me asking for help.
ನಮ್ಮ ವಾಲಂಟಿಯರ್ಸಲ್ಲೇ ತುಂಬ ಜನ ಅವ್ರಿಗೂ ಕೋವಿಡ್ ಬಂತು, ಅವ್ರ ಫ್ಯಾಮಿಲಿಯಲ್ಲೇ ಕೂಡ ಡೆತ್ಸ್ ಆಗ್ತಿತ್ತು.
I have a very strong connection with India because I used to live there for more than a year, close to Bangalore.
Our mission, which is connecting people, improving lives.
What was needed at that point of time is to have more medical facilities.
You may call it a miracle, magic, or pure luck. There are times in our lives when things fall in place in the strangest of the ways. People come together when you least expect. Paths open up when all avenues seem blocked. This is one such story. A story of people and resources coming together for a cause from across the world. Their cause to give people gasping for life a breath of fresh air. It was April 2021. The second wave of the pandemic was peaking. India was among the worst affected countries in the world. The COVID cases were mounting alarmingly. Hospitals were overburdened. There was an acute shortage of beds. The oxygen was scarce, the infrastructure inadequate, and the establishment clueless and struggling to cope. Time was running out. Death was knocking on every door. Under these circumstances, when most people locked themselves in, a few compassionate citizens stepped out to save others. Among them were Vinay Kumar, Dr. Vasu, and a group of NGOs, including Project Smile Trust from Bengaluru. Helpless to see so many people suffering due to lack of oxygen, Vinay, who is a patent consultant and a Bengaluru-based activist, took to social media, spearheading the campaign to arrange oxygen concentrators.
Well, I was bombarded with a lot of distress calls. I've never had so many people reach out to me asking for help, and I did not even understand why people were calling me asking for oxygen, for hospital beds. It was quite overwhelming. That was when I think pretty much the entire country was lost, including the government, not knowing what to do. And thankfully, I had made some amazing connections around the world thanks to travel and the kind of projects that I do. And just recently, when around COVID second wave in India around April, few months before that, I had made some friends in Germany. They were also involved in volunteering, and there were people who had indulged in some volunteering work in India as well. So I knew perhaps that they could help. These are the first people that I reached out to, my friends Francisca and Monia. And just around that time, the government of India had issued a notification that have relaxed the import duties and taxes for some category of oxygen devices.
Vinay's appeal went viral, triggering a snowball that gathered unknown people, funds, equipment, and logistics from across continents in a miraculous way. Parallelly, another Bengaluru activist stepped in to take the initiative forward in collaboration with Project Smile Trust. A medical practitioner and social activist working with the unorganized and marginalized sections of the society, Dr. Vasu was instrumental in getting 124 concentrators arranged during the second wave of the pandemic.
ಕೋವಿಡ್ ಸೆಕೆಂಡ್ ವೇವ್ ಸಂದರ್ಭದಲ್ಲಿ ಒಂದು ತುಂಬ ಪ್ಯಾನಿಕ್ ಒಂದು ಎಲ್ಲ ಕಡೆಗೂ ಶುರುವಾಯಿತು. ಕೋವಿಡ್ ಫಸ್ಟ್ ವೇವ್ನಲ್ಲಿ ಇದು ಗೊತ್ತಿರಲಿಲ್ಲ, ಇಟ್ ವಾಸ್ ಲೈಕ್ ಎನ್ ಅನ್ನೋನ್ ಫಿಯರ್. ಬಟ್ ಕೋವಿಡ್ ಸೆಕೆಂಡ್ ವೇವಲ್ಲಿ ಇಟ್ ವಾಸ್ ಪ್ಯಾಲ್ಪಬಲ್, ಯಾಕಂದರೆ ಡೆತ್ಸ್ ವರ್ ಹ್ಯಾಪನಿಂಗ್, ಮತ್ತು ಆಕ್ಸಿಜನ್ ಸಿಗುತ್ತಾ ಇಲ್ವಾ, ಹಾಸ್ಪಿಟ್ಲ್ಗಳಲ್ಲಿ ಬೆಡ್ ಸಿಗುತ್ತಾ ಇಲ್ವಾ, ICU ಬೆಡ್ ಸಿಗುತ್ತಾ ಇಲ್ವಾ, ಇದು ಈ ಪ್ಯಾನಿಕ್ ತುಂಬ ಇದ್ದಿದ್ದರಿಂದಾಗಿ ಒಂದೇ ಸಮ ಪ್ರತಿ ಪೇಷಂಟ್ ಕೂಡ ಅವ್ರಿಗೆ ಗೊತ್ತಿರೋ ಡಾಕ್ಟರ್ಸ್ಗೆ ಅಥವಾ ಆ್ಯಕ್ಟಿವಿಸ್ಟ್ಗಳಿಗೆ ಕಾಲ್ ಮಾಡೋಕ್ಕೆ ಶುರು ಮಾಡ್ತಾಯಿದ್ರು. ಸೊ ಆ ಸಂದರ್ಭದಲ್ಲಿ ನಮಗೆ ಭಾಳ ಜನಕ್ಕೆ ಅನ್ನಿಸ್ತು, ಇಲ್ಲ ಇದು ನಾವು ಇಂಡಿವಿಜುವಲ್ ಆಗಿ 1-to-1 ಹೆಲ್ಪ್ ಮಾಡೋಕ್ಕೆ ಅಷ್ಟೇ ಅಲ್ಲ, ವಿ ನೀಡ್ ಅ ಕೋಆರ್ಡಿನೇಟೆಡ್ ಎಫರ್ಟ್ ಅಂತ ನಮಗೆ ಅನಿಸಿದ್ರಿಂದಾಗಿ ಒಂದು ಹೆಲ್ಪ್ಲೈನ್ ಶುರು ಮಾಡಿದ್ವಿ. ಆ ಹೆಲ್ಪ್ಲೈನು ಎಲ್ಲವೂ ಕೂಡ ಒಂದು 6-7 ಡೇಸ್ನಲ್ಲಿ ಅದು ಎಸ್ಟಾಬ್ಲಿಷ್ ಮಾಡಿದ್ವಿ ನಾವು. KCVT ಅಂತ ಆಗ ಅದನ್ನು ಕರೆದ್ವಿ, ಕರ್ನಾಟಕ ಕೋವಿಡ್ ವಾಲಂಟಿಯರ್ಸ್ ಟೀಮ್ ಅಂತ. ಸೊ ಒಂದು ವೇಳೆ ನಮಗೆ ಯಾರೋ ಕಾಲ್ ಮಾಡ್ತಾರೆ, ಅವ್ರಿಗೆ ನಾವು ಹಾಸ್ಪಿಟಲ್ಲಿ ಬೆಡ್ಡನ್ನು ಕೂಡ ಕೊಡಿಸ್ಲಿಕ್ಕಾಗಲ್ಲ ಅಂದಾಗ, ಆಕ್ಸಿಜನ್ ಕೂಡ ಸಿಗ್ತಿಲ್ಲ ಅಂದಾಗ ಏನು ಮಾಡೋದು ಅನ್ನುವಂಥ ಪ್ರಶ್ನೆ ಬಂತು. ಸೊ ಅದೇ ಟೈಮ್ನಲ್ಲಿ ಬೆಂಗಳೂರು ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ನ 92 ಬ್ಯಾಚ್ನ ಕೆಲವು ನಮ್ಮ ಫ್ರೆಂಡ್ಸ್ ಏನು UK ಮತ್ತು US ಅಲ್ಲಿದ್ದಾರೆ, ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ US ಅಲ್ಲಿದ್ದಾರೆ, ಅವರು ಅಲ್ಲಿ ನಾವು ಫಂಡ್ಸ್ ರೈಸ್ ಮಾಡಿ, ಇಲ್ಲಿಗೆ ಆಕ್ಸಿಜನ್ನ ಶಾರ್ಟೇಜ್ ಇಷ್ಟೊಂದು ಇರೋದರಿಂದ ಮತ್ತು ಕೂಡಲೇ ಆಕ್ಸಿಜನ್ ಪ್ರೊಡಕ್ಷನ್ ಕೂಡ ಸಾಧ್ಯ ಇಲ್ಲದೆ ಇರೋದರಿಂದ ಕಾನ್ಸಂಟ್ರೇಟರ್ ಇಸ್ ಎ ಗುಡ್ ಆಲ್ಟರ್ನೇಟಿವ್. ಹಾಗಾಗಿ ವಿ ಕ್ಯಾನ್ ಸ್ಪಾನ್ಸರ್ ಇಟ್ ಅಂತ ಅಲ್ಲಿಂದ ಶುರು ಮಾಡಿದ್ವಿ.
As the social media campaign caught on, Vinay's friends from Technik on Grenzen in Germany, Franziska, Monia and Kristen, were the first to respond to his appeal, kickstarting a fundraiser through betterplace.org. After initially struggling to find a supplier, the German trio found a willing ally in Marvin, who helped them procure the concentrators.
So when Vinay approached us first with the request of helping him with procuring oxygen concentrators and other medical equipment, I wasn't sure that we can do it. But I have a very strong connection with India because I used to live there for more than a year, close to Bangalore. So I just needed to do something. I was worried about my friends there, about their families. I was following the news. And for me it was clear. And after talking to Monia, we decided we just try. So we set up a link on Better Place, a fundraiser, and it was crazy how it took off. The first few days, we were not sure if we could actually manage because we got a lot of negative feedback from suppliers. But then Monia managed to find a supplier who was ready to help us, and he did everything trying to find those equipment for us. And after one day, the fundraiser took off like crazy, and so many people jumped in, friends, family, colleagues, and they donated money and they supported.
The next task was to import these concentrators across to India. That's when the global logistics giant DHL came forward for a door-to-door delivery free of cost.
DHL were extremely proud to be one of the most international companies in the world, being active in more than 220 countries and territories. But we're even more proud of our mission, which is connecting people, improving lives. So this is the reason why we didn't think twice when Project Smile approached us and asked us to transport 15 pallets of urgently needed medical equipment to India in order to fight COVID.
Within 48 hours of Vinay's appeal, the first 2 shipments of around 100 concentrators arrived at the Project Smile Trust warehouse in Bengaluru, all the way from Germany. Many more followed in the next few weeks from the United States of America and Singapore. In Singapore, an alumni group of National University of Singapore, Nanyang Technological University, and Singapore Management University launched the fundraising initiative called Singapore University's Mission Oxygen. Sumo raised around $171,000 through their campaign on Milap.org, helping them buy and ship 50 plus concentrators to India. Project Smile Trust received 30 of these concentrators in Bengaluru, while the rest were sent to other cities facing the oxygen crisis. Additionally, a mother-daughter duo from Bengaluru, Neelu and Anvi Mittal, also played a part in the campaign.
my daughter is in grade 12, and last year she was in grade 12, and she also runs a social initiative called Ration Square of her own. And in 2020, when the COVID really started, is when she had mobilized ration, because food grain support was really needed by these migrant laborers. And then in 21, when I was raising money for oxygen cylinders and COVID related care, she also joined me, and she mobilized the student community, and they raised some money for to fight COVID.
Eventually, 650 concentrators arrived, some from within India, including those that the Project Smile Trust acquired independently. Little did this diverse collective know that together they were about to pull off one of India's biggest pandemic response operations during the second wave.
Initially, our target was 10 concentrators, right? We had no clue how much we will generate. We thought, okay, we have enough people to support 10 concentrators, and we started sharing that fundraiser page with people across the world. And slowly, help started trickling in, and then I connected with a doctors group in US who were also planning to send concentrators, and they had a shortage in US, but they had collected some funds. So they said, can we route all the funds to you? And since you anyway have access to devices in Germany, why don't we collaborate?
With the concentrators in possession, the real challenge now was to distribute them to those who needed them the most. That is when the Project Smile Trust stepped up the gas. The Trust's long-standing experience in emergency relief and humanitarian activities came in handy. By this time, Project Smile was already at the forefront of COVID relief activities, working under the umbrella of Mercy Mission in Bengaluru. Armed with so many concentrators, the Trust's emergency response machinery came out in greater force, reaching out far and wide through its vast network of volunteers.
So, with the start of the pandemic in the year 2020, in the first wave, that is when we started procuring oxygen cylinders, because there was not enough hospital beds for people. So we had people, manning these helplines. All of this in the beginning were all volunteers who used to work in shifts. And due to the emergency, we were working 24/7. So in the second wave, again, it hit us suddenly and it was exponential. And even though we had oxygen cylinders, the problem was the oxygen plants and oxygen supply all over was a problem. Even big hospitals had an issue, getting oxygen on time. People struggle for it. So even we couldn't get our cylinders refilled on time. And plus, when people took the cylinders, they didn't return it on time. So that's when the idea came that concentrators are needed. So once the concentrators came in, again, we needed to have a team to ensure people, to educate people on how to use these concentrators, how to decide, to whom to give, because there's a shortage. One way was these concentrators were also sent to other COVID care centers all across Karnataka, North Karnataka, Gulbarga, Andhra and Tamil Nadu. So we have sent the concentrators to various institutions who needed this at that point of time.
From reaching out to remote areas in Karnataka and equipping several government health centers with the concentrators to extending its long arms of compassion all the way to Bihar and Tamil Nadu, Project Smile pushed the paddle when the country needed the most.
Yavatmal in Maharashtra is one of the most remote, neglected regions in Maharashtra, in Vidarbha region. So to see, us being able to make an impact in such a distressed region was very heartening. And then we've had our concentrators go to workers in tea estates in remote areas in Valparai, Tamil Nadu, and some tribal health centers in Tamil Nadu.
In Bengaluru, a helpline under the umbrella of Mercy Mission was making concentrators available to individuals at their doorsteps, while its counselors were making sure patients were getting the right treatment.
So this counseling team used to look at all of these things. Can we get him a hospital bed? Can we get him some treatment? Along with the oxygen, can we also make sure that his problem is solved? What was needed at that point of time is to have more medical facilities with medical staff who can actually attend completely to the patient, along with these oxygen facilities. But for emergency cases, it's the medical facilities which need to be upscaled.
Joining hands from across the world, this humane collective of donors, volunteers, activists, NGOs, as well as common men and women pulled off a miracle, breathing new life into thousands of patients who were otherwise staring at certain death.
ಒಂದು ಆಗಿದ್ದಿದ್ದು ಪ್ಯಾನಿಕ್ಗೆ ಒಂದು ಕಾರಣವೂ ಇತ್ತು. ಅಂದರೆ ಡೆತ್ಸ್ ವರ್ ಆ್ಯಕ್ಚುಲಿ ಹ್ಯಾಪನಿಂಗ್. ನಮ್ಮ ವಾಲಂಟಿಯರ್ಸಲ್ಲೇ ತುಂಬ ಜನ ಅವ್ರಿಗೂ ಕೋವಿಡ್ ಬಂತು, ಅವ್ರ ಫ್ಯಾಮಿಲಿಯಲ್ಲೇ ಕೂಡ ಡೆತ್ಸ್ ಆಗ್ತಿತ್ತು. ಇನ್ಫ್ಯಾಕ್ಟ್ ಒಂದು ಟ್ರೈನಿಂಗ್ ಸೆಷನ್ ತೊಗೊಳ್ಬೇಕಾಗಿತ್ತು ಕೋವಿಡ್ ವಾಲಂಟಿಯರ್ಸ್ಗೆ. ಆ ಟ್ರೈನರ್ ಯಾರಿದ್ದರು, ಆ ಟ್ರೈನಿಂಗ್ ಸೆಷನ್ ಆಗಲಿಕ್ಕೆ ಕೆಲವು ಗಂಟೆಗಳ ಮುಂಚೆ ಅವ್ರ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಒಂದು ಡೆತ್ ಆಯಿತು. So, but still training session continued. So this was the situation then. But ಏನಾಯಿತು, ಎಲ್ಲರೂ ಕೂಡ ಹಂಗಿದ್ದಾಗಲೂ ಕೂಡ ಎಲ್ಲರೂ ಇಲ್ಲ, ಇದು ಒಂದು ತುಂಬ ಒಂದು ಕ್ರೈಸಿಸ್ ಸಿಚುಯೇಷನ್ನು. ಈ ಕ್ರೈಸಿಸ್ ಸಿಚುಯೇಷನಲ್ಲಿ ನಾವು ನಮ್ಮ ರೋಲ್ ನಾವು ಪ್ಲೇ ಮಾಡಬೇಕು ಅನ್ನೋ ರೀತಿ ಒಳಗಡೆ ತುಂಬ ಜನ ಆಲೋಚನೆ ಮಾಡಿದ್ರು. ನಿಜ ಹೇಳಬೇಕಂದ್ರೆ ಈ ಸಮಾಜದೊಳಗಡೆ there is so much good also. People rise up to the occasion.
One of humanity's greatest virtues is rising up to the occasion when all seems lost. When pushed against the wall, hope is our only armor.
I think at the core of everybody's efforts were doing something for humanity without looking for labels or borders. It just didn't matter. Everybody knew that every little energy that went into this project would end up saving lives. No matter how much of pain, suffering, injustice you see, humanity can triumph all of this, and humans will, I think inherently there is that goodness in every human being. I think through our actions try to bring the best out of each other. And when we execute something like this, hopefully it will inspire everyone to see the good in every human being, and hopefully we will not have much of the violence and hatred that we see around us.
Miracles do happen. Often they start with just one simple step, one act in good faith, or a heartfelt appeal to human conscience. The rest falls in place.